One skin problem that almost all of us want to treat but we don't because there's so many misconceptions regarding it are anti-aging treatments. Now in this video, I'm going to tell you what anti-aging treatments are right for you. I'm going to be brutally honest about the advantages and the side effects of these anti-aging treatments, and I'm going to guide you so that you can choose the right anti-aging treatment for yourself. So there are two types of anti-aging treatments in a dermatology clinic. There are non-invasive anti-aging treatments and there are invasive anti-aging treatments. In non-invasive anti-aging treatments, there are primarily two technologies. One is ultrasound based and the other is radio frequency based. So the ultrasound based is also called high intensity focused ultrasound or HIFU. There are many HIFU devices, but the one that I have used are Therapy and Hironic. So what happens in HIFU? There is delivery of ultrasonic wave that actually converge to a single point and then they heat this point. This is how HIFU can be used to target the skin, collagen or the fat. Now who is the ideal candidate for HIFU? Now we mostly perform HIFU on patients who have bulkier face, because the deeper cartridge of HIFU, the one that goes most deep, can hit the fat and can help in dissolving the fat. So anybody who has a heavy face is best treated with the HIFU. For patients who have slim face, we usually recommend radio frequency based skin tightening. Now let's talk about the advantages and the side effects of HIFU. So in HIFU, we apply a numbing cream on the patient's face and then we start giving the shots. It is one of those few devices that do not give any downtime whatsoever. There's no redness, there's no penetration of the skin, there is no post-treatment bruises on your face. So you can actually get HIFU done in the morning and attend a party in the night. So this treatment is perfect for patients who want anti-aging treatment with absolutely zero risk, zero side effects. Some of the very rare side effects that are reported in the literature are irritation of the nerves, because when we give ultrasound energy, it can also hit the nerves on your face, so it can cause you mild irritation. Other than that, we usually don't see any other side effect if the treatment is performed correctly. Now let's move to the second non-invasive anti-aging treatment, that is radio frequency based. In this, we can use a device that delivers radio frequency superficially, or we can use something like a Morpheus which sends the needles inside the skin and then delivers radio frequency. Superficial radio frequency, like in our clinic we have Apollo Duet, is perfect for patients who do not want any sort of redness, any sort of pain. However, the best result in this type of treatment is seen with multiple sessions. So if you're going for superficial radio frequency, you have to be ready to take it multiple times. The second one is Morpheus, which delivers radio frequency inside the skin. So there are needles that penetrate the skin. This one has little bit of downtime, little bit of redness that may last for 3 to 4 days. This also requires multiple treatments, but those treatments can be gapped at several months. The results are definitely better than superficial radio frequency, and it also helps in acne scars and reduces your pores. So you can choose this treatment if you have these problems as well. So to summarize, the non-invasive dermatological treatments done in our dermatology clinics are generally very safe. The results can vary patient to patient and depends highly on the machine and the treatment provider. Usually our patients say there is an improvement of around 15 to 20% per session. Now let's talk about invasive anti-aging treatments. The two main treatments here are Botox and fillers, and both are very trending and very talked about, and there is a lot of misconceptions about these. What is Botox? Botox is a chemical that blocks the connection between the nerve and the muscle. So what it works is on dynamic wrinkles. Now if you are somebody who is fed up with their forehead lines, their crow's feet, then I recommend that you can consult your dermatologist for Botox. Botox is mainly done on the forehead and for the wrinkles around the eye, and if done properly, it is very safe. It is very standardized in this area. If you are doing Botox in any other part of the face, that is in the mid face or in the lower face, these are the areas where the side effects are slightly more common. So if you're going for Botox for these areas, then you have to be very careful in choosing your service provider. And even if you choose the best one, there is slightly higher chance of developing some kind of side effect that you might not experience if you're just going for the upper face Botox. Do I recommend it? Yes, you can do for the mid face and the lower face as well, but do talk to your dermatologist about the side effects and keep a little bit of window for recovery in case you have a big social event coming. Now coming to the next popular invasive anti-aging treatment is the fillers. Fillers, like the name suggests, are actually hyaluronic acid and it's to fill. So what happens with aging is that the bones retract, the fat in the face is lost, so we use fillers to replace them. Now some videos on social media or some so-called industry experts or some aesthetician may say that fillers will help you lift the face, but fillers is to fill. In my personal opinion, they do not help in lifting the face. However, in some cases they can be put in areas which may change the shape of the face a little bit, and it may look like for several weeks or several months that your face is lifted, but actually fillers is not to lift the face, it is to fill the volume deficit. So when it comes to fillers, unnatural result is possible. So I always like to start slow. I don't inject too much, because if you inject too much, your face can look a bit bloated. In my opinion, fillers give best results under the eye for a volume deficit that develops with age on the cheek area. Fillers give wonderful effect on the lips and also sometimes to open up your cheek and squaring of your jaw. If we talk about side effects, there might be some pain post the treatment. There can be swelling of the filler, there can be bruising, and if the filler is placed too superficially, it can look like a bulge. Most of these side effects go away on their own, but it can take 2 to 3 days. Some of the side effects, if they're not resolving, we always have an option to dissolve the filler. So do I recommend it? Yes, especially for people who age with very thin face. Fillers can give a great effect. However, if you have bulky face, I'll advise you to go for less quantity of filler. Finally, the last invasive anti-aging treatment is thread lift. So what we do here is make an entry point near the side locks of the patient, and then we put threads down and we create two kinds of lift. One is we lift the nasolabial fold like this, and the other is we lift the jawline. Thread lift is one of the best treatments if you are going for non-invasive improvement of your nasolabial folds. The best part is they can be even done on a heavy face. Apart from lifting your face, the threads also induce collagen and it overall improves the face tightness. If we talk about side effects, you can have pain that can last to up to 2 weeks post procedure, and I recommend if you have an event coming up, then you should go for this treatment at least 2 months before. These threads that are under your skin dissolve over time, and usually it takes 1.5 years to dissolve. So even if there is some problem associated with it, it gets corrected automatically within few months. So this is a summary of invasive and non-invasive anti-aging treatments that are available. There's some more available, but these are the ones that are more common, and there are a lot of misconceptions about these ones. If you have any question about these treatments that I talked about or any other treatment related to anti-aging, please write them in the comment section. Please subscribe to our channel and click on the like button if you like this video. I'll see you in the next YouTube video. Until then, goodbye.